Great. All right. So Tim is with us. It's the only participant so far.
I am the only participant.
So far, we had like 70 people sign up, but
Get out.
It's nice meeting you.
Oh, it's nice to be here.
Great.
I'm excited.
So are we. Where are you from, Tim?
Nebraska.
All right.
USA. Where all are you from here?
Kind of all over the globe. So myself, I'm Israeli based in Belgium. I'm CEOing EarWay's Medical. We'll talk about us. And then Martin is in Switzerland. Chris is in Canada. And Dave and Alicia are in the US as well.
Very good. Nice to meet all of you.
Nice meeting you.
You too, Tim.
All right, and we do have another participant with us. Ah, it's Allison. Okay. Hi, Allison. All right. Quick question to the panel. When you look at your screens, do you see everyone's image or do you see just the presentation?
I see everyone's image.
Everyone's
The presentation is fine.
Okay, so I'm gonna narrow down this, all right, to do it like that, so we can see only the speaker. That's better.
Better.
Okay, good. All right. We'll give it 1 more minute. And I think we will start in a couple of minutes. All right. Dave, it's, yeah, I think we can, maybe we should wait because I see that people are coming in a bit late, a couple of more minutes, and then we can start.
Okay, sure.
All right. I think maybe we should, let's start.
All right, cool. I'll kick it off. So
Great.
thank you. Thank you, everybody who is attending live. Thank you to those of you who are watching the recorded version of this. So today we're going to be talking about the EarWay Pro, you know, kind of a deep walkthrough of how this device works and some of the real world uses that folks like Chris and Alicia, you know, based on their experience in their clinics. So just to kick things off, my name is Dave Kemp. I am the Director of Business Development at Oak Tree Products. And so as a distributor of, you know, clinical supplies to the hearing health industry, this is one of these new products that we're carrying. And so we wanted to support the EarWay's team here by bringing everybody together and just, you know, having a walkthrough of how exactly this device works. So for our panel today, we have a great lineup. So we have, I'm going to read some of these bios here. So we have Alicia Spoor over on the left. So Dr. Spoor is the past president of ADA. She is also the president of Designer Audiology located in Highland, Maryland. She received her doctorate of audiology from Gallaudet in Washington, D.C., and her BA from Michigan State University in audiology and speech science. Prior to opening her practice, she was part of the cochlear implant and hearing aid teams at the Mayo Clinic, Arizona, and worked at 2 private practice audiology practices around the Baltimore, Maryland, and Washington, D.C. areas. Like I said, she's the past president of ADA and the current legislative chair of the Maryland Academy of Audiology, MAA. So thank you, Alicia, for being here. Next on the screen, you'll see Yael Karlin. Yael has a track record of 20 years in the medical device industry, first with J&J and since 20 years in the startup field, bringing products from the concept stage to the market. Yael is CEOing EarWay Medical for more than 3 years and worked with the company since the early concept stages. Next, we have Martin Reedy. He is working in the hearing health industry for more than 15 years on the manufacturer and retail side. Before entering the hearing health industry, he worked 10 years in the tourism industry and 7 years in the financial services industry. Martin is very passionate in bringing innovations to the market. He joined EarWay Medical's 1.5 years ago as head of sales and marketing for EarWay Medical. And then finally, we have Chris Hewitt. Chris is a registered hearing instrument practitioner in the Vancouver, Canada area. He is a partner at Pacific Audiology Group. They are a relatively new company and they provide online training and continuing education in hearing healthcare using Ultra HD video tutorials. Prior to this, Chris owned and operated his own private practice and has worked in training and sales roles with Oticon and Siemens. Okay, so I think to kind of kick things off here, this is a brief itinerary of the agenda. So we'll look at an intro and the mission of EarWay Medical, talk about why earwax is a problem, look at some of the ways in which earways can be cost effective and streamline processes in the clinic, the product itself, some of the training that goes around this particular solution, and then key elements for a successful procedure, looking at specific use case in the clinic, and then followed at the end by some Q&A. So with that, I will now let Yael take it away.
All right. Thank you very much, Dave. Thanks for this intro and welcome everyone. EarWay Medical has started from a real need from an ENT in Israel who came up to Dr. Amir Kreitzer, who's a serial entrepreneur, a biomaterials expert, and a mechanical engineer. And she told him that it's not possible that in her day-to-day clinic, she sees up to 50% of patients showing up with earwax. And she said, can you please find a solution that they either do it at home or would be easier for me to do it in the clinic? And at the beginning, he told her, come on, we're the 21st century. I'm sure there's a product out there that you don't know of. But when we started digging into the solutions that are available, we found out that there's been little to no innovation within the cerumen management domain. And more than that, the products that do exist out there require a lot of training and might be risky if they're misused. So having that said, we have decided and set our goals and mission to found EarWay Medical for the really well-being of millions of children and adults around the world, providing easy-to-use ear care products that are based on clinical evidence. So the company is really an ISO 13485 medical device. Our products are tested clinically first, and based on that, we after bring them to the market. The problem of earwax, as you might know, and this is just to make things, a bit more interesting, is one that is not a very sexy one. But as we dig in more and more, we find out that it's even been discussed recently as an alternative specimen for forensic analysis, as you can gather a lot of information about an individual, the ethnicity, race, the diseases that he's carried, even which food they've eaten yesterday, have they been to McDonald's or to Burger King. But the real big problem, and here I'm going to pass it over to Chris, who's the expert, is that cerumen impaction is affecting, at the end of the day, 850 million people seeking help from professionals to remove it. So Chris, please go ahead.
Thanks, Yael. You can hear me okay?
Yeah.
Good. So yeah, our problem with cerumen as clinicians and of course as patients is we see it's a pervasive problem. We're getting close to a billion people worldwide who are having some issue with cerumen impaction. And it's one of the treatable forms of hearing loss, which the World Health Organization identified as something they want to really try and mitigate and eliminate. And so we see up to 60% of older adults, 10% of children. So it's affecting a lot of people, and it causes problems for us in the clinic. Difficult to get reliable audiometric measures and to fit hearing aids reliably. And then for the patients, it can cause temporary hearing loss, tinnitus, and of course, some discomfort and even dizziness. And you can see the bottom stat there is Google search terms related to earwax removal are up incredibly to 5,000% during the COVID pandemic. So again, some of the issues related to hearing aid fittings, that's a big one for me and for Alicia too. If you're not performing cerumen management, and if it's not done in a safe and convenient way, the clinicians end up referring people to specialists and outside of the clinic, which is inconvenient for your patient. It can cause delays. You can lose your patients or your clients altogether, depending on where they end up. And that's one of the big ones. There's a lack of good education, of good training, of easy, convenient tools to use, or there has been. And some of the equipment to get started with cerumen management, if you're looking at things like microscopes and suction, they take up a lot of space. They can be quite costly. And then we have infection control we're dealing with, especially this past year. And that's been, we'll talk a little bit more about infection control in a few slides, but that's an issue that's come up with disinfection and sterilization and doing that properly. And so something like the EarWay's tool, which is a single-use product, is really relevant right now. And then, of course, having worked for hearing aid manufacturers, we saw a lot of this, but hearing aids are damaged by and large by earwax and moisture, and sometimes moisture related to earwax that migrates into receiver tubing through wax filters. It finds ways to get into the hearing aid. And so not dealing with cerumen management at the clinic level, at the hearing aid clinic, just leads to more hearing aid breakdown. So we want to take a moment to talk about infection control and as it relates to hearing healthcare and cerumen management. There's a study that we've seen, I guess it's a little older now, it's from 1992. And there's a misbelief, I guess, that using objects in the ear on intact skin does not create the risk of infection. And so this study from 1992 looked at specula otoscope tips in physicians' offices to assess their likelihood to carry pathogens. And the findings spoke for themselves. We saw 32% of the otoscope tips were carrying pathogens, which is okay, I guess. The same study also showed a self-report section which asked physicians questions on their infection control practices. And they reported that disinfection of specula was not commonly practiced, again, due to this misbelief that ear tools were safe when they were used on intact skin, which is false. So tools used on intact skin do carry pathogens, and ear tools are very likely to carry and transmit disease when not sterilized and disinfected properly. So COVID-19 is our pathogen this year. We have some evidence to show that it's present not only in the ear, but in cerumen, because cerumen contains blood. or can contain blood. So from an infection control standpoint, we need to treat all cerumen tools as if they could transmit COVID. And so in infection control, we look to the characteristics of the pathogen we are dealing with to determine which precautions are needed. And right now, with COVID-19, it's taken hold of the world. We want to look at the transmission characteristics. So you can see on the right side of the slide, the most common types of transmission. COVID-19 transmits primarily through direct contact and droplet transmission. And so we want to use this sort of information to guide precautions and modifying factors and precautions we might need to take in order to safely practice cerumen management, especially right now. And so we like the EarWay Pro tool for this, because typically with curettage, with using standard curettes with an otoscope or a head-worn head loop and a microscope to some degree, the clinician's face is quite close to the patient's face because of the requirements for lighting and magnification. And so you can see with the EarWay Pro tool, the mouth of the clinician, which is me in this photo, and the mouth of the patient are somewhere close to 1 meter apart, maybe 2 to 3 feet. And then the other thing that's worth noting with infection control is the length of time that it takes to perform cerumen management. If you use this tool properly, the sort of interaction time is quite short compared to many other methods. And so when we talk about, public health experts refer to time of exposure with COVID. How long were you with an infected person? Not just how close were you to them, but how long were you there with them? And so we like this tool because it minimizes that time you have to interact from a really close distance. And then, of course, because it's disposable and single use, it's a really good choice, especially right now during the COVID-19 pandemic. So for the training that we do on all aspects of cerumen management right now, we've got a few recommendations. One is to go disposable and single use. So this checks that box. We want to avoid irrigation because that creates additional risk with COVID. And we want to keep our distance from our clients whenever possible. So the EarWay Pro gives a big check mark from us. I know it's not suitable for every single type of wax and every client, but when it is, we encourage people to try it.
Okay, Chris, thank you very much. We're going to walk now through the solution. And because we have participants today from across the globe, I encourage you to go back and check in regards to the indications and licensure. Everything that has to do with cerumen management differs, even within the US, from state to state, and definitely in Europe from country to country. So just a kind reminder that the EarWay Pro is intended for the use of professional healthcare providers and physicians that are licensed or certified to extract cerumen from the external auditory canal. So I think this is an important say on our side. And back to the solution. As I said, the EarWay Pro and EarWay's Medical is basing all of its products and solution on clinical evidence. It's extremely important for us. Our products are not a gadget, and in order to have something which is sustainable, we need to have this very solid approval within the professional community. So the EarWay Pro has been tested with 59 ears with an ENT, presented, published the study, and we keep ongoing pilots and post-market surveillance in order to gather and collect the data and improve the product itself, but also improve our training and the recommendations that we provide to you. The study that I was mentioning was performed at Kaplan Medical Center in Israel by Dr. Au.D. He's an ENT and the head of the cochlear implant center at the hospital. And the product was at its very first generation. So it was bare. It didn't have a silicone coating that the products have today to make it softer within the bony canal. We tested 59 ears in 46 patients, and the product, the study has been presented at IFOS in Paris back in 2017 and published. We'll be more than happy to share the publication with you. The interesting thing was that the success rate was from the get-go very high. It standed on 86.5%. The mean time was 30 seconds per procedure. And despite the fact that the product was not coated, 83% of the patients did not feel any pain or discomfort. And the complication rate was extremely low and would have happened with any other product. And it was only mild irritation with the canal, with the skin. So what we do continue to do, as I mentioned, is benchmarking pilots. And you can see here one which is in the UK, a Canadian pilot, and 2 in the US, with all of them having a duration of a procedure in seconds under 1 minute, and safety, which has rated on a scale of 1 to 5, very high. And I hope that you will feel it after you try the product as well. The success rate here is standing again at a scale of 1 to 5 at an average of just under 4. And this is because at one point, the HCPs which are participating are stopping to report. We have a learning curve which Alicia would discuss and share her experience with. Our recommendation is 15 to 20 patients. And here, all of the HCPs that participated, after less than 10 patients have started to report, yet the success rate was very high. The product itself. So the EarWay Pro has 7 years of research and development behind it. It seems like a very small shaft plastic tool, very tangible. You know, we're living in a very digital, sophisticated world. But sometimes innovation and the ultimate sophistication is in the simplicity and the out-of-the-box thinking. And when Dr. Amir Kreitzer was challenged by the ENT, he was thinking, but what can I do different? And it dawned on him that all of the products today are either trying to suck the wax out with the microsuction or wash it out, or they're penetrating. If they're mechanical, they penetrate the wax. And he was thinking, why not go around, try to surround it and pull the full plug, the impaction together. And this is how he came up with the helical head, which has an open profile. So the open profile, which is our biggest innovation, is actually the cavity within the helical head. So if you think of it as a corkscrew, like some people would refer to it, it's actually one of those old ones that does not go in, but from First World War, that would have kind of the engulfing of the plug itself. The helix has a silicone coating to make it more flexible, more soft on the bony canal, and a flexible neck, which is enabling navigation. And you can see 2 markers, the distal and the proximal, that are based also on evidence and CT scans. And they're your indication, they're your actually safety anchor versus where you are towards the tympanic membrane. What I'm going to do now is actually walk you through a little tutorial that we have, and we encourage you to watch it before you start using the product on your patients for a couple of times. You can see very well here the open profile within the helical head. You can see how flexible the neck is and that there's a silicone coating. The power that you have on the shaft, on the handle, is really giving the force here on the tip when you turn it. We have 3 sizes, also based on research in order to fit the different canal types. So what to do? When you go in, obviously before using it, make sure that there's no foreign object and that there is earwax really there. We did have some audiologists and HCPs so excited that they forgot that there was a deep in the canal hearing aid. So please, of course, make sure. Then check the size. The size, the product has to fit comfortably at the entry of the meatus, so sitting there, not a lot of space left. And the important thing is that if you're in doubt, there's no doubt. Size one up, because we do want the product, unlike other products you're using, to touch the canal walls. And we want your patient to tell you, oh, I feel that it's turning inside there. Here we took the medium size, which is the most common size that we see. And then go ahead and straighten the pinna superiorly and posteriorly in order to straighten the canal. This is very important because the patient feels that the canal, that the product is turning in his canal. When the canal is straight, the transfer within the passages between the cartilaginous canal and the bony canal is much softer and easier. Now we encourage you to start turning the product before you even really enter the canal for two reasons. The first one is that you will feel the difference between an empty canal and a full one. And the second one is that your patient would actually tell you, oh, I feel more pressure. And this is a good indication that you're actually engulfing the wax. While you're doing this, have a quick look at the proximal and distal markers. When the proximal marker, which is closer to the eardrum, is aligned with the meatus, have a quick look at your patient's eye. If they're comfortable and they're not squinting, go ahead and move to the second marker up. What's going on? Good. So, and then once the second marker is aligned, turn on the spot 360. Do not advance the product further in the ear canal, and slowly but surely pull out straight without turning the product. Only when the product is out, release the pinna and have a quick look to see if the full plug is out. So this is up. I need to close this, go back to the presentation. As I said, the product is clinically tested and has all the regulatory necessary approvals across the US, Canada, TGA Australia, and Israel Healthcare. Alicia, I'm gonna let you take the stage from here.
Perfect. Thank you for that. I always like seeing that video, partially because that never happens in real life. But also it's a good reminder that if it does happen in real life, make sure you take a video and a picture of it. So yeah, so a couple things that I've noticed as I've been using this tool in my clinic, gosh, for the last probably 3 or 4 months now, is that, well, let me preface, I'm an audiologist in the United States. So if anybody's joining us worldwide, welcome. But in my state, we are licensed to clean cerumen from the ear. But I really think it's so important because everybody is different and because education levels are different, the physicians, the audiologists, dispensers, depending on where you are, you still need to obtain that thorough case history from the patient, because obviously when you're looking in the ear canal and you're looking and you're seeing wax, obviously you can't necessarily see behind the wax if it's fully impacted. You need to know the rate of medication on any type of issues, surgery to the head, neck, and ear area, and that's going to make a difference as to what tools you can use. I mentioned this to Yael last week as well. I use EarWay Pro as just another tool in my toolbox. So I don't use it on 100% of the patients, and you'll see my favorite slide in just a few minutes. Because it's not for 100% of people, but it is for a lot of patients that you see. And I think you'll see that in just a few minutes. So the other thing too is once you do your case history, you're kind of going through the same process that you would when you're doing otoscopy. And so when your patients are seated, as I am now in my clinic garb, they still need to be comfortable. They should still be at your ear or your eye level should still be about where their ear is. So if you're seated, if the patient needs to be raised or lowered, if you are comfortable standing and bending over and looking down, whatever that might be, that patient needs to be comfortable. And in my cerumen tool or chair, which is not this one, I have the headrest so that the head can go back on that headrest just to give me another frame of reference. And so the patient can't be moving their head all the way around. And I think that's, as most of us know, that's helpful not only for otoscopy, cerumen removal, ear mold impressions, squirmy people that might have any type of neurologic issues, twitches, things like that. So that's kind of where we are on the patient side. Once you look in and you judge the diameter, this was the hardest thing that I had to overcome, was to go the one step larger that Yael mentioned before. So when I look in somebody's ears, I'm probably not the best judge of size as to, do I need the small, medium, or large? And so I would look in and I would pick the medium because, you know, I can kind of tell a small, narrow ear, but most of my patients don't really seem like large ear canal people, so I'd pick the medium. I was wrong initially, probably about 50% of the time. And so when Yael kind of counseled me and coached me through this, and she's like, one size larger, one size larger, one size larger. And I finally did one size larger. It was like the clouds were opening up. And it makes a huge difference. So I can't stress that enough. If you are in doubt, go one size larger, because you're better off maybe being too large and backing back down to a medium than you are going in and getting things tangled up and getting stuck in the middle of a lump of cerumen and then having to go in and do it again. It's less than a minute, so it's not terribly long, but if you can get it on the first try, that's where that sizing up is. Like I mentioned before, the bracing technique is really the same as you're doing with otoscopy. We all like our fingers, right? Some people use their ring finger as well, but when you're bracing, you're still using the side of the head. You're still using that pinky and maybe that ring finger when you're twisting it, so it's easy to hold and twist while you've got your pinky on that patient's cheekbone, you know, TMJ area, whatever that might be. If you're left-handed, well, you can figure it out if you're left-handed, because I'm not. And you're still pulling that ear up and back as you would when you're doing otoscopy. So it's a very kind of natural process because you're doing it with your patients already. So you don't have to learn a whole nother set of technique when it comes to the bracing side. What I have found with my patients is when I start twisting it, I make sure and show them and let them feel. I'm a big fan of having them feel things. So I always kind of, you know, take the EarWay Pro and move it around on their hand before I put it in their ears. All patients wash their hands when they come into my clinic, so I am confident that that's clean and I'm not transmitting any germs, especially during the COVID time. But they can feel that coating, they can feel it. And when I tell them that I'm going to put it in and twist it and you're going to feel it, when they feel it, they don't get as worried about it. So when I'm putting it in and I'm twisting it and they feel it, it's kind of like a, oh yeah, whatever. When I insert it to the second marker, this is one of the other big things, which I think is true for all of us when we start working with the deep inserted hearing aids, when we start doing cerumen impression, the deep fitting ear mold impressions, you know, the patients initially are kind of the, and they start to pull away or they start to twitch their eye, and just a very comforting, I know you're feeling this, we're almost done, or you're doing great, you know, we've only got one more turn to go, makes a huge difference. So don't be afraid with that little bit. They are meant to feel it. And a lot of my patients will come back and say they don't care what it feels like as long as things are clear when we're done. And they would much rather have that kind of little bit of pressure as they feel it twisting around. And one time it's out, as opposed to multiple pressures, sometimes with irrigation, manual, whatever it might be. And then I don't know if you caught it. Sorry. I don't know if you caught it in the video. When you get to that second marker, the recommendation is to make another whole twist around, and I know Yael said this too, but another whole 360 turn without inserting any further to make sure you've got all the way around the ear canal, everything is loosened. And that makes a big difference if there's any type of skin issues, if there's any dry skin, you know, we want to have a clean pull when it comes out. So the ears can sometimes be very dry. Sometimes as our patients get older, their skin is obviously more fragile. The ear canal is obviously more sensitive. So that extra turn in there makes a really big difference. You just have to make sure that last turn you're not inserting any further. And then again, when you pull, you can pull straight out. I usually don't recommend yanking it out, but it is kind of fun to see it. So it is that moment of like pulling it out, and I, as a clinician, am always like, look, you want to see? This is really cool. And most of the time they do want to see it. So Yael's laughing at me. We've got another video. You can kind of see on this one, you're welcome to play it. You can see the brace is still the same and he's got his pinky on. And Yael, you can explain who these people are if you'd like to.
All right, so basically, this is a very interesting story. On the right is Dr. Au.D. He's managing the otology department at Rabin Center in Israel. And on the left is a manager partner in our product design studio. And we were working on our next generation products. And he said, oh, I think I have earwax impaction. So obviously, this is not a clinic or and it is pre-COVID times. It's actually a few days before Israel went into lockdown. And you can see that he's smiling, and I'm gonna stop it here because Dr. Khili started off, he didn't even have an otoscope, but he started off with the medium size. And the manager here said, but I don't feel it turning inside my ear. And when he said that, this was an indication for Dr. Khili to go one size up. And he took the green one, which is the large one, and within less than 40 seconds, the full plug was out. And what I really wanted to emphasize here, within the learning curve, and Alicia, go ahead, and obviously Chris, I would be happy for you to address it, but I know that for right-handed audiologists and HCPs, the left ear is more of a challenge. And this is why it was important for us to share this video, because you can really see how, you know, the brace is done and how Dr. Khili was pulling out the plug. We skipped the full plug coming out, but yeah. So this is, and here we can actually see the product. This has been done within the UK, and you can see from the second I started the video, the 30 seconds that it would take to bring out this full impaction out. And I think that it's important to say that this is one of the first attempts of this specific audiologist with the product. So within the learning curve, it was fairly quick. And Alicia, I think this is why you say the product is addictive.
Definitely.
Yeah, and you can see that the ear canal and the patient are ready for the next testing and stages of the appointment. So there you go, the beauty of it. If you would have asked me 5 years ago, if I would have been talking so much about earwax, then I'm not sure I would have said yes, but here I am. So, all right, Alicia, back to you for the key elements.
Sure. Thank you. I like those videos too. And I think especially here in the US, any of us, we know how much of an impact YouTube and TikTok and Instagram, I don't know if Instagram does videos, can have, but those videos are certainly very helpful. As Yael mentioned, I really think having done this, I really think you need about 15 to 20 patients to kind of get that learning curve down. That's not ears, that's actual patients. So we know not every patient has cerumen impaction in both ears, but usually if they come in, they have it in at least one ear. Obviously, starting with your patients that have normal canals, they don't have any surgical alterations, they don't have any issues in the head and neck area is extremely important. And if you can start with healthy adults, that always makes it so much easier. We know that when you learn something new, we often practice on colleagues and coworkers, and that's mainly because you know that they're healthy, they're going to be a little more tolerant. So if you have those patients that you are seeing on a routine basis for cerumen already, and you can try this as something new, especially when they come back in the clinic, you already know what you would typically do with them. And so you can try something new without having this fear of, I've never seen this patient before, I'm not quite sure what I'm getting into. Obviously, we want to make sure that mental cognitive issues are addressed. And I mentioned it was addictive, but just remember every patient's unique, and what works for one doesn't always work for the other. And I think we kind of talk through the rest of that part. But I can tell you as a private practitioner, I love doing cerumen removal because not only does it bring me a different type of patient into my clinic, so these aren't necessarily patients that are coming in for hearing tests or for hearing aid fittings. These are people who are coming in actively because they think they have wax in their ears. It also brings me additional revenue. So as business owners, a lot of us on this call fall into that category. We know that what we do is valuable and there's a cost to it. So I make quite a bit on cerumen removal, and so I like having that as part of my portfolio in my private practice. This is my favorite slide. One day I'm going to have a mural painted on my cerumen room with just this slide information. And I think it really goes to show the type of earwax you can use EarWay Pro to remove. And so in learning this and kind of talking to different people in the different areas, it's easiest, I think, in that kind of what I call the peanut butter type of cerumen, which we see in a lot of Caucasians and in a lot of darker skinned patients, whether that be African, African American, Indian, Asian. No, not Asian, Indian type of patients. But the other thing that I found as well is that, and this is even talking to people, I remember it stood out in Arizona, when you have kind of that hard wax, we often think, oh, well, we'll just soften it. But when you have dry, crumbly wax as well, which this came out of that talk with those in Arizona, a little bit of I'm a big fan of Debrox, Earwax MD, mineral oil, whatever you're using that you're comfortable to put into the ear canal to soften it. That dry crumbly wax, sometimes if you just add a little bit of lubricant to it, makes it into that peanut butter consistency, and then the EarWay Pro works really well again. So don't be afraid to use something to kind of soften or to condense the wax together before you start using EarWay Pro if you think you want to use it on that patient and they don't necessarily fit into that peanut butter paste, which is my favorite type of wax to remove, which again, I never thought I would be saying as well. Again, we talked about sizing it up. It can't be understated, but Yael, you want to explain this video as well?
Yeah, sure. Thanks, Alicia. So basically, I was mentioning the big innovation about thinking out of the box while designing the product with the open profile. So you might know a lot of gadgets out there that are corkscrew-like for the patient themselves to use. And it's extremely important for us to show here. So this is our silicone ear model with some Play-Doh and the product, and show how safe it is. Obviously, the skulls of your patients are not transparent, so it's just to visualize how the product really works inside the ear and the ear canal, and the fact that it does not push the wax, but rather really engulf it and grabs it as a whole, and you still have the buffer and the space between the tympanic membrane and your product. So you're not pushing it towards the TM. So here we go. Just to show you again from another angle. how the product is working inside the canal. There we go. And it's very important to do everything very slowly. Even if you do it extremely slow and you feel that it's slow motion, it still takes around a minute or less. So don't hesitate. The slower you do it, also, the more comfortable your patient is. And I really need to echo you, Alicia, on this. Walk your patient through. So tell them what you're doing, where you are with the markers, how it's feeling. Let them also describe. It really makes the whole experience of the wax removal with the product nicer, easier, and especially when they see the fun of what comes out. Alicia, I'm going to give it back to you for the contraindications and indications.
Sure. So I think you guys can all see and read the slide. This shouldn't be anything too terribly out of the ordinary. And it's really the same contraindications that you would be looking for if you were using irrigation, if you were using manual instrumentation, or if you were doing suction. So again, nothing out of the ordinary. And this is why starting with patients that you already know because you're actively doing cerumen removal can help with that learning curve process. Obviously, the whole point of this tool is to take cerumen out of the ear, not foreign ear body. So cerumen out. And you can use this for both completely impacted or partial impaction. So you may be able to see the eardrum and do what you need to do diagnostically, but if you decide to take an image or a scan, if you decide that you need to make ear mold impressions, if you decide you want to fit a deep-seated hearing aid, this might be the case where you want to take out that partial non-occluding cerumen. And again, EarWay Pros can be a very fast, easy way to do that. Obviously, we already talked about staying within the scope of your practice, but I don't know about you. I always ask my patients, especially as I'm doing a procedure, I always say, do you want to see the wax when I pull it out? And most of them say yes, not all of them, but most of them say yes. They want to see what it looks like, what it is. We can talk about how to prevent the buildup, when they need to come back and see me based on what they're seeing as well. And it gives them validation for me as a clinician also. And so being able to show them the little stick with wax in it is a little bit easier than showing them this image on your left where you've pulled out bits and pieces and everything along the way. But I think patients like to see it. They like to be validated in what they're experiencing. And so that's why I think it's important. Again, I can't stress this enough. If you've listened to any of my presentations in the past, I'm a big proponent of counseling the heck out of people. I don't say it in such as nice terms the first time around, and it makes everything going forward a lot easier. So the more the patient knows and sees and understands, and then they feel it, the better it's going to be both for you and for the person that you're administering it on. We already talked about a headrest, patient's eyes. I use my loops for every patient that I see. I like to have the additional light source with it. You saw a couple of videos where they didn't have the light sources. So this is your level of comfort, what you need to feel like you're doing a good job and being safe. But even in the COVID times, right, I've got my head shield on. I can put my loops underneath it. My mask is still covering my mouth. It's just an easy process for me to have my loops there. So I do it with loops. But again, everything else is kind of the same. So once you practice, again, I feel like if you can take the time and practice on 15 to 20 patients, it will just become second nature. And you can look at an ear and say, yep, I can use the EarWay Pro for that, or nope, I'm going to go this route, or you know what, the patient, right, whatever, irrigation was awful last time, let's do something manual, and this is when you pull out your single stick to go in with that EarWay Pro and counsel them. So once you get past that initial learning curve, again, I feel like, not to be in the dark, I feel like it is just another tool that you can have in your toolbox to best work with the patients that walk into your door. So with that, I think there's one more slide. Yeah, you can see, as a private practice owner, I've mentioned this as well. Number one at the top, it's additional revenue. I can't keep my doors open if I don't pay the bills. And again, this is a whole new segment. If you want to reach out to people who aren't coming into your clinic, it's a whole different population. It's a whole different age group than what a lot of audiologists and dispensers are working with on a regular basis. And it can be a whole different arm of or branch of your clinic if you want to do that. So I'm a big fan on the revenue side of things. I will say that the patients that come into my practice, when we talk about ear cleaning, they always go home with recommendations about ear and hearing health. So it's not one of those things where they walk in and they walk out and I never see them again. Sometimes they follow up with me, sometimes they don't, but we talk a lot about what do you do to prevent this from happening, or what do you do to prevent this from happening so much so that when you come in, it's a 30-minute long process as opposed to a 1-minute long process. So this can be a big revenue source when it comes to selling over-the-counter cerumen removal kits, when you're starting to talk about how often do you need to come back. I find a lot of patients come in and then they want to talk about sinus and allergy issues around hearing loss with seasonal issues, or they want to talk about custom hearing protection, or they want to talk about, whatever it might be, musician and ear monitors. And so reaching them through the earwax and cerumen removal process only leads into other types of appointments and revenue sources. And I was running my numbers yesterday. That happens either for additional diagnostic services or devices that could be sold, or accessories, which I would consider cerumen eardrop kits to be an accessory. It's somewhere between 25 and 50% of the time for those patients. And those are patients that I wouldn't have been seeing if they weren't coming into me for cerumen removal. So it can definitely help bring in more revenue. It's very timely. I do find that one of the things that you need to think about if you're going to implement cerumen in your practice is that these patients typically want to be seen in 1 or 2 days. They're not usually calling and saying, oh, my ear's plugged, can you see me in 2 weeks? Or they're not calling and saying, well, I think my ear is going to be plugged in a month. Can we make something at the end of June? Right? They want to come in right away. So you might have to work with some of your providers, and you might have to look at your schedule to figure out, can you do some block scheduling? Can you do something where you can offer those same days? I'm a big fan of walk-in appointments, which isn't as feasible right now still with the COVID pandemic, but can you get them in at the end of the day over lunch? Do you have an hour where you can squeeze them in tomorrow to take care of that? Talked about continuation of care. And again, I can't stress this enough, working to full scope of practice so that I know that at least when I worked in the Mayo Clinic system, we kept our surgeons doing surgery. We kept our audiologists, doing the audiologic testing, and we kept our assistants doing the assistance role. So being able to do that full scope of practice is a big thing for me, but also can help bring in revenue where it's most efficient within that entire scope. Within your practice, whether it be physician down, audiologist down, dispenser down. So I'm going to stop talking with that and turn it back to Yael, and she can close it up from here.
Thanks a lot, Alicia. I can't see if I'm up. Okay, I'm good. I thought I was on mute. So it's really just to, and this would be our closing slide because we're running a bit out of time. But, the costs and losses, and it's really to show more on a practical way how much bringing the service of cerumen management within your clinic can really help you grow your own business. So we know that the companies are spending from $400 in average, but even higher numbers, just in order to bring in the lead generation, the new patients in. And then you have to pay your rent, you have to pay the audiologist per hour, and you have to do the ear examination. And in average across the globes with the clinics we're working with, we're talking about 30% of patients just stepping in with earwax. And the earwax removal on the site can be performed for various reasons, from legislation to audiologists that are too timid of performing the procedure. Only in around 15% of the cases, there's real earwax removal, successful one on the spot, that leads to continuing to do the fitting and selling of a hearing aid that can bring you, or whatever it is the patient stepped in for. But if it is selling of a hearing aid, we're talking about, again, with the average selling price in the US of $4,000 for a pair of hearing aids, of around $3,500. And what happens is that 85% of these 30% of patients, the removal was either unsuccessful or there wasn't even an attempt to remove the wax. And within those 85%, 60% just drop out from the pathway to audiology. This is something which it's numbers that are across the board reinforced, and we see them from NHS in the UK, which is the largest governmental healthcare provider, through institutes in the US. There's a huge dropout rate, which eventually turns out to a potential loss of $4,500. And we feel that it's a shame that it's all due to earwax that was not proposed for the patient. A lot of the time, it's elderly patients coming in with a carer or a family member that took the day off to be with them. They might not do it again. And this is what really happens in real life. 60% of them drop out. And the percentage that does reschedule, there's still additional costs for coming in. So we just want you, kind of to bear in mind that this additional service is absolutely crucial for you streamlining the patients, providing the full service and scope. And it's a huge advantage for your patients stepping into your clinic. So with that, I'm actually gonna skip to the next slide because we're really short on time. And I think, Dave, I'm gonna give it back to you in regards of the benefits we have here for the attendees and whoever joined us today.
Yeah, no, I think this has been a terrific webinar. Thank you to Alicia and Chris for really helping to break that down. And then obviously Yael for all the color around the history of the company and how this product has been brought to market. So thank you for everybody who attended here. We do have a couple promotion codes. So at Oak Tree, if you use our code EarWays10, you'll get 10% off of all EarWays products between now and June 5th. So for about the next 2 weeks. Also with Pacific Audiology Group, you can use the code OakTree20, which will provide a 20% course discount. And they for up to 4.5 CEUs until June 30th. So again, thank you to everybody. And I think I hit everything. So unless I'm missing anything else, I think that should wrap it.
Any questions from everyone?
Yeah.
I'm going to stop sharing. Thank you, of course, everyone, for joining us. And we do hope that you're going to dive in or test the water gently, but eventually adopt the EarWay into your practice. So I'm going to stop sharing. If there are any questions, I see there's something in the chat.
Thank you for the wonderful program. I've got to go, but it was excellent. I appreciate it. I look forward to working with you.
Thank you very much, Tim. Likewise.
Tim.
Hi, everyone. Any questions? Nothing? All right. All right, I'm gonna stop the recording. Thank you again, everyone. Alicia, Martin, Dave, if you can wait a couple of minutes, Allison as well.
Yeah, Yael, the question
Yeah,
or Dave.
we're gonna send the recording. Yes, absolutely. We're gonna share it.
Good, perfect.
Yeah. Any other questions before we
Thanks, everyone. Have a good day.
on
Have a good afternoon.
Yeah. All right. Okay. All right. Okay. Okay, guys. I removed everyone, so.
Great.
I'm
Go
sorry
ahead.
if I'm long-winded.
No, you're thank you very much. It was excellent. I see that Chris is not here anymore. He dropped out, I guess.
Yes, I think he went for breakfast.
Yeah. He has a brunch now going on. All right. What did you guys think? Alison, Dave, it's the first time you're joining us for, first of all, Alicia, thank you for the phenomenal job as usual. You're a natural born digital, media kind of presenter.
Trying to keep up with Dave over there in his TV shows.
Yeah. True.
No, I thought it was really great. I'm glad that we recorded it too, because I know we had a number of people emailing us saying they couldn't attend live, but they would like the content. So I think I'm excited that we now have that we can send anybody for, those that are intrigued